Prostate cancer is one of the most common cancers among older men, and yet, many people don't know the earliest signs until it's too late. What if the body gives us quiet, subtle warnings long before things get serious? In today's video, we're diving into the early symptoms of prostate cancer that every senior should know. These aren't just vague suggestions or fear-mongering guesses. These are medically backed, research-based clues that could save your life or the life of someone you love. Stick with me to the end, because knowing what to look for might be the key to early diagnosis and better outcomes. Frequent urination, especially at night. Waking up once or twice in the night to use the bathroom might seem like a normal part of aging, but when those trips become more frequent, especially without drinking large amounts of fluid before bed, it's time to take notice. Frequent urination, medically known as nocturia when it happens at night, is often dismissed as a harmless annoyance. However, for men over 60, this can be one of the very first signs of prostate trouble. The prostate gland surrounds the urethra, the tube that carries urine out of the body. As the prostate begins to enlarge, even slightly, it can press against the urethra and reduce the flow of urine. This makes the bladder feel fuller faster and more often. Studies published in journals like the Prostate and BJU International have shown that nocturia is more than just a sleep disruptor. It's a measurable predictor of prostate irregularities, including cancer in its early stages. If you notice that you're going to the bathroom 3 or more times a night, despite cutting back on fluids in the evening, that's not something to brush off. The Cleveland Clinic warns that frequent nighttime urination, especially when combined with a weak urine stream, is often the first complaint among men later diagnosed with prostate cancer. What makes this symptom tricky is how common it is among seniors, which is why it's often attributed to age alone. But while benign prostatic hyperplasia, BPH, or an enlarged but non-cancerous prostate can also cause nocturia, it's impossible to know what's going on without proper screening. That's why the American Cancer Society recommends annual prostate screenings for men over 50, and even earlier for high-risk groups, including African American men and those with a family history of the disease. Another red flag is urgency, when you feel a sudden, intense need to urinate and can't hold it. This might mean your bladder is being affected by something more than age. While it might not be painful, the inconvenience and disruption to sleep quality can have a long-term effect on your physical and mental health. Poor sleep leads to fatigue, reduced immunity, and decreased focus, making a manageable issue spiral into larger health problems. And if you find yourself falling asleep during the day due to interrupted rest at night, it's worth considering whether your urinary habits are trying to tell you something. You might also notice you're going during the day more frequently than before, and not just after drinking coffee or water. Pay attention to patterns. Are you planning your outings around restrooms? Are you avoiding long car trips or events because you fear not finding a toilet in time? These adjustments, often made silently, are signs that your body is compensating for something abnormal. This creeping change in quality of life is often overlooked but can be very telling. Importantly, this symptom alone doesn't mean you have prostate cancer. But it does mean you should get checked. Prostate-specific antigen, PSA, blood tests and digital rectal exams are simple, often painless procedures that can help catch issues early. According to the National Cancer Institute, early-stage prostate cancer is almost always treatable and has a 5-year survival rate of nearly 100%. That's the power of early detection. So if your nights are becoming more interrupted, and your days revolve around bathroom breaks, speak to your doctor. You're not being paranoid, you're being proactive. Difficulty starting or stopping urination. One of the most overlooked warning signs of prostate cancer is trouble initiating or halting urination. While it might feel like a mere inconvenience at first, this symptom is one of the clearest early red flags that something may be going wrong with the prostate gland. The prostate surrounds the urethra, so even a slight enlargement, whether due to benign conditions or malignant growth, can cause noticeable interference in urine flow. You may find yourself standing at the toilet, waiting longer than usual for the stream to begin. There may be hesitation, dribbling, or a feeling that you need to strain just to get started. Likewise, finishing may feel incomplete, as though you still need to go, even when nothing more comes out. These changes might seem small at first, but for older adults, particularly men over 60, they warrant close attention and medical follow-up. From a physiological standpoint, These issues are tied to how urine flows through the urethra. A prostate that is growing inwardly, whether due to a tumor or benign swelling, compresses this passage, creating resistance. As a result, the bladder must work harder to push urine through, leading to muscle fatigue over time. This strain on the bladder doesn't just make urination difficult. It can eventually cause bladder dysfunction. Over time, this may lead to urinary retention, where the bladder doesn't empty fully, a serious issue that can result in infections, bladder stones, or even kidney damage. According to the Mayo Clinic and Johns Hopkins Medicine, difficulty initiating or stopping urination is one of the most frequently reported early symptoms in men later diagnosed with prostate cancer. It's important to understand that this isn't about the occasional hard-to-start stream after a long car ride or holding it in too long. We're talking about a consistent, progressive change in how your body functions. If you've started noticing that urination feels like a task requiring effort, or if you're experiencing a stop-and-start flow, those are signs worth taking seriously. Moreover, if these issues are accompanied by a sense of urgency or the feeling that your bladder is never quite empty, you should act sooner rather than later. One danger is that these changes often happen gradually. Men adapt, often unconsciously, adjusting their habits or blaming age. But the fact remains, these aren't normal shifts, and they don't occur without a cause. Another critical piece of this puzzle is the connection between urination difficulties and prostate inflammation or infection, conditions which, while not cancer, can mimic or obscure more serious diagnoses. Prostatitis, for instance, can cause similar urinary issues and may lead a man to dismiss his symptoms as temporary. However, distinguishing between inflammation and early-stage cancer often requires imaging, blood work, such as PSA testing, and sometimes even a biopsy. That's why self-monitoring isn't enough. You need professional input. The National Institutes of Health stresses the importance of early evaluation for urinary hesitation, especially when it becomes routine. What's also notable is that emotional stress can make these symptoms worse. The longer the delay in diagnosis, the more anxiety can build, creating a feedback loop where tension worsens urinary control. This mental strain, compounded by poor sleep and reduced quality of life, can significantly impact seniors. That's why medical intervention isn't just about diagnosing cancer, it's about restoring comfort and dignity. Even if the cause is benign prostatic hyperplasia, BPH, effective treatment options exist, from medications that relax the prostate muscles to procedures that open up the urethra. The American Urological Association urges men not to tough it out when they notice these symptoms. There's no shame in seeking clarity. Your bladder and kidneys work as part of a delicate system, and dysfunction in one area can cascade into bigger issues if left unchecked. Even if it turns out not to be cancer, addressing urinary trouble early can spare you from more invasive interventions later. In fact, several longitudinal studies, including one published in the Journal of Urology, have shown that early medical evaluation for lower urinary tract symptoms improves outcomes and overall survival when prostate cancer is found. So if you find yourself hesitating, stopping, and starting, or never feeling like you've fully emptied your bladder, take it seriously. Don't wait for the discomfort to grow. Your body is giving you a signal, listen to it. Weak or interrupted urine flow. A weak or interrupted stream of urine is often an embarrassing symptom for men to discuss, but it is one of the most significant early warning signs of prostate cancer that should never be ignored. When you go to the bathroom and notice that the urine flow has lost its pressure, or if the stream stops and starts unpredictably, it may indicate an obstruction in the urinary tract, often caused by the prostate gland enlarging or becoming misshapen due to the presence of a tumor. This change is not a random occurrence or simply the result of aging. It reflects a deeper disruption in how your urinary system is functioning, and it can often be the first whisper of a serious health issue developing silently in the background. To understand why this happens, it's important to grasp how the prostate is situated in the male anatomy. The prostate wraps around the urethra like a donut around a straw. If this gland begins to grow, either from benign prostatic hyperplasia or from malignant cell changes, it can squeeze the urethra. As pressure builds around this narrow tube, the result is a reduced urine flow, often described by patients as trickling, dribbling, or spurting instead of a steady stream. According to the American Cancer Society and Harvard Medical School, These symptoms are among the most common urinary changes experienced in the early stages of prostate cancer, often developing gradually over time. Many men ignore this symptom, assuming it's just part of aging, but studies show a clear correlation between weakened urine flow and the likelihood of prostate-related disorders, including cancer. A comprehensive study published in the British Journal of Urology International found that men reporting changes in urinary stream strength had a significantly higher incidence of prostate abnormalities upon examination, including early-stage tumors that were previously undetected through other symptoms. What makes this symptom especially dangerous is how slowly it can develop. It becomes easy for men to rationalize it, maybe I drank less today, or maybe it's just a little cold, when in reality, these subtle, cumulative changes can signify that something more serious is going on. Interrupted flow, where the stream starts and stops multiple times during a single urination session, is another variation of the same issue. This inconsistency often reflects the bladder struggling against resistance, trying to expel urine through a partially blocked urethra. Over time, this strain on the bladder muscles can lead to overactivity, fatigue, and incomplete bladder emptying, which increases the risk of urinary tract infections, bladder stones, and other complications. More alarmingly, long-term obstruction can eventually lead to backflow pressure on the kidneys, risking serious renal complications. This is why a weak or erratic stream shouldn't just be tolerated or worked around. It should be medically evaluated with urgency. Medical professionals often use uroflowmetry, a non-invasive test that measures the speed and volume of urination, to assess how well your urinary system is functioning. In conjunction with PSA blood tests, digital rectal exams, and ultrasound imaging, this can provide a full picture of whether prostate cancer might be the cause of the obstruction. And while many of these symptoms can also be caused by BPH or even urethral strictures, only proper screening can determine the root cause with accuracy. Early detection is crucial. When prostate cancer is caught before it spreads, treatment options are much more effective and less invasive. One overlooked consequence of this symptom is the impact it has on daily life and emotional well-being. Constantly feeling the need to urinate but not being able to do so efficiently can cause frustration, anxiety, and even social withdrawal. Men may avoid long outings, limit fluid intake unnecessarily, or develop subconscious stress around public restrooms. This hidden toll can affect not just physical health but also relationships and mental health. Seniors especially may fear discussing this symptom, thinking it's too personal or not serious enough. But silence only gives the problem more time to grow. Encouragingly, there are numerous treatment paths depending on the cause. If caught early and found to be cancerous, prostate issues may be treated through radiation therapy, hormone therapy, or minimally invasive surgeries like robotic-assisted prostatectomy. If the cause is benign, medications that relax the prostate or shrink it can dramatically improve flow and quality of life. But the first step is recognizing that a weak or interrupted stream is not just a nuisance, it's a potential warning bell. If you've noticed your urine stream isn't what it used to be, or that you're pausing mid-flow more often, don't wait to see if it worsens. Prostate cancer, like many diseases, often whispers before it screams. Catching it during that whisper phase could save your life. Pain or burning sensation during urination or ejaculation. A pain or burning sensation during urination or ejaculation is not something any man should ever brush off as normal, especially in later years. While it might be easy to assume such discomfort is due to a urinary tract infection or temporary irritation, in older men, this symptom can signal a more serious issue brewing within the prostate. Painful urination, medically referred to as dysuria, and painful ejaculation, which is even less frequently talked about, are often early warning signs that inflammation or malignancy may be present. These sensations are frequently dismissed due to embarrassment or the false belief that pain is a routine part of aging, but the reality is starkly different. Persistent discomfort when urinating or ejaculating should be a loud and clear signal that it's time to seek medical evaluation. The prostate plays a crucial role in both urination and ejaculation, making it a central player in any issue involving pain in these functions. When cancer cells begin to form and multiply within the prostate, they often create inflammation and increased pressure in the surrounding tissues, including the urethra and ejaculatory ducts. This can result in irritation that produces a stinging or burning sensation. According to a study published in the Prostate Cancer and Prostatic Diseases Journal, men reporting pain during ejaculation were significantly more likely to have underlying abnormalities in the prostate, including early malignancies. The prostate's location and function make it especially vulnerable to producing these symptoms even in the early stages of disease. If inflammation is localized near the urethra or seminal vesicles, both urination and ejaculation may become painful long before other symptoms appear. Moreover, unlike symptoms such as frequency or weak flow, pain is harder to rationalize. Pain during ejaculation, in particular, is not a widely discussed topic among older men, yet it can be one of the earliest signs of cancerous change, especially when accompanied by pelvic pressure or lower abdominal discomfort. Many men remain silent out of shame or uncertainty, avoiding conversations even with healthcare providers. But pain is never normal, and when it involves such specific bodily functions, it demands careful examination. The National Comprehensive Cancer Network notes that pain in these areas may also be indicative of other prostate conditions such as prostatitis, but that distinction can only be made through proper testing and clinical evaluation. This is why it's critical not to self-diagnose or wait it out, particularly if the pain recurs or intensifies over time. A key factor to consider is the role of nerves and inflammation in pain perception. As prostate cancer cells grow, they can compress surrounding nerves and cause neuropathic discomfort. This is not always sharp or intense. It may manifest as a dull ache, burning, or even a tingling sensation that is difficult to describe. This discomfort may radiate to nearby areas, such as the perineum, lower back, or inner thighs, further complicating diagnosis. According to the American Urological Association, these nerve-based symptoms are sometimes misattributed to sciatica, pulled muscles, or even digestive issues, leading to delays in diagnosis. This is why a full urological workup is essential when pain occurs during ejaculation or urination, especially in men over 55. Some men also report increased sensitivity or pain during sexual activity, not just ejaculation. This too can be linked to changes in the prostate, as inflammation alters the function of seminal fluid production and can cause spasms or resistance during muscle contractions. While these symptoms might overlap with other conditions like chronic pelvic pain syndrome or infections, they should never be dismissed without a full medical assessment. Pain is the body's alert system. It's how internal issues make themselves known. And in the case of prostate cancer, where early-stage disease is often silent, pain may be the only signal your body gives you that something is wrong. The treatment approach will vary based on the cause. If the pain stems from inflammation, antibiotics or anti-inflammatory medications may offer relief. However, if the discomfort is due to malignant changes, early treatment can make a world of difference. Modern prostate cancer treatments, including targeted radiation and hormone therapy, are most effective when started early. The earlier you act, the better your chances of avoiding invasive surgery and maintaining your quality of life. The key is not to let pride, fear, or embarrassment delay your response to pain. If it hurts to urinate or ejaculate, listen to that pain. It's trying to protect you, not shame you. Blood in urine or semen. Seeing blood in your urine or semen can be a terrifying experience, and rightfully so. This symptom, known respectively as hematuria and hematospermia, should never be overlooked or brushed off as a one-time event, especially for older men. Even a small trace of blood, whether it's bright red or rusty in color, is a loud warning bell from your body that something may be seriously wrong. While there are multiple causes of blood in these bodily fluids, one of the most concerning is prostate cancer. This doesn't mean every case of hematuria or hematospermia is malignant, but these symptoms are strongly associated with abnormalities in the prostate gland, including inflammation, infection, and tumor growth. Unfortunately, many seniors chalk it up to something minor or delay visiting a doctor out of embarrassment or fear. That delay could cost valuable time that's critical if prostate cancer is developing silently. The prostate lies just below the bladder and surrounds the urethra. It also produces seminal fluid, so any abnormality in the gland, be it swelling, trauma, or the formation of cancer cells, can lead to bleeding in the surrounding structures. When the blood vessels within the prostate are affected by a tumor or chronic inflammation, they can rupture or leak small amounts of blood into the urinary or reproductive tract. This bleeding may be visible to the naked eye, only detected during laboratory tests. Either way, it's not normal and must be thoroughly investigated. According to the Journal of Urology, hematospermia is present in about 14% of patients diagnosed with prostate cancer in its early stages, often showing up before other symptoms develop. While blood in urine is more commonly associated with bladder or kidney issues, it is also a potential indicator of prostate cancer, especially when found alongside urinary difficulty or pelvic discomfort. Some men may only notice the blood once or twice and assume it's resolved, but intermittent bleeding is common in early-stage cancers. The bleeding may come and go, depending on physical activity, sexual intercourse, or even the position of the prostate at the time. This irregular pattern makes the symptom easy to dismiss, but medical experts strongly urge men to report even a single episode. The American Urological Association recommends a full workup, including urinalysis, PSA testing, and a prostate exam, anytime blood appears without a known cause. This is especially true if the man is over the age of 50 or has a family history of prostate disease. In some cases, blood in the semen is the only symptom present in the early stages, and missing it could mean missing the best window for successful treatment. What adds to the complexity of this symptom is its emotional weight. For many men, seeing blood during a moment as intimate as ejaculation can be deeply distressing. It may create anxiety around sexual activity, strain relationships, or lead to avoidance behavior. But shame should never silence what could be a life-saving observation. Healthcare providers are trained to handle these discussions with sensitivity and confidentiality. In fact, raising the issue shows strength and responsibility, both toward yourself and your loved ones. Acting on the symptom doesn't mean you're jumping to conclusions. It means you're taking control of your health in a smart, informed way. Medical imaging, such as a transrectal ultrasound or MRI, can provide further clarity on the source of the bleeding. In cases where prostate cancer is the cause, early intervention is vital. Localized prostate cancer, when confined to the gland, is highly treatable, with 5-year survival rates nearing 100% according to the National Cancer Institute. The real danger is ignoring or hiding symptoms until the disease spreads beyond the prostate, when treatment becomes more complicated and the prognosis less favorable. Even if cancer is not the cause, discovering another treatable condition like a urinary tract infection, prostatitis, or benign prostatic hyperplasia still improves your overall well-being and prevents future complications. It's also worth noting that certain medications, like blood thinners or aspirin, can sometimes cause blood to appear in urine or semen. But even in those cases, you should not assume that's the explanation until a doctor has ruled out more serious causes. Self-diagnosis can be dangerous, and waiting for the symptom to go away on its own is a gamble no one should take. Blood in any bodily fluid is nature's emergency signal, a vivid, unmistakable marker that your body needs help. Don't ignore it. Don't wait. Bring it up at your next medical appointment and insist on a thorough evaluation. That decision might just save your life. Unexplained pain in the lower back, hips, or pelvis. Unexplained, persistent pain in the lower back, hips, or pelvic area is one of the more insidious early symptoms of prostate cancer and often the one most overlooked or misattributed. That's because these types of aches and discomforts are common in older adults and frequently blamed on arthritis, muscle strain, or general aging. However, when this pain becomes chronic, doesn't improve with rest or over-the-counter medication, or seems to intensify over time, it may be much more than a muscular or skeletal issue. In men, particularly those over the age of 60, this kind of deep, dull, or sometimes sharp pain can actually be an early indicator that prostate cancer cells are beginning to spread, especially to nearby bones and lymph nodes. The spine, hips, and pelvic bones are common metastatic sites when prostate cancer begins to move beyond the gland, making early recognition of these symptoms critical. The challenge with this symptom is that it's nonspecific. A man might notice he has trouble getting out of bed in the morning due to back pain or that his hips feel sore after a walk, yet instead of seeking medical evaluation, he assumes it's just a normal part of aging or a sign of overexertion. But cancer-related pain behaves differently. It doesn't come and go with activity. It often feels deeper, more persistent, and can worsen during rest, especially at night. Unlike muscular pain, which might fade with stretching or heating pads, Cancer pain is usually unrelenting and may be accompanied by a sense of pressure or a gnawing sensation. This is because prostate cancer, when spreading, tends to invade the bone tissue, causing inflammation and structural weakening that leads to significant discomfort. According to the American Cancer Society, once prostate cancer spreads, the bones are the most common place it travels to, and bone pain is often the first sign of this progression. What makes this particularly dangerous is that many men may experience this pain long before they receive a diagnosis. In fact, research published in Cancer Epidemiology, Biomarkers and Prevention has shown that many patients diagnosed at later stages recall having lower back or hip pain for months prior, but they attributed it to unrelated causes like aging or old injuries. This kind of retrospective clarity is heartbreaking because early detection could have significantly improved their treatment outcomes. That's why any ongoing pain in these regions, especially if it's not linked to a known injury, deserves immediate medical attention. Pain caused by prostate cancer metastasis is also typically resistant to common pain relief methods. If you've been taking ibuprofen or acetaminophen without real relief, and your discomfort seems to deepen rather than dissipate, it's time to ask whether the root cause is being ignored. Some men describe the pain as bone deep, or like a constant weight pressing inward. Others report stiffness that seems to have no mechanical explanation. Because the prostate is located deep in the pelvis, early local spread can irritate surrounding nerves, causing radiating pain through the lower back or down into the thighs. This often mimics sciatica, but without the obvious spinal causes. One of the reasons this symptom is especially crucial to catch early is because once prostate cancer spreads to the bones, it moves from being a localized illness to a systemic one. At that stage, treatment becomes more complex. Although advanced therapies like androgen deprivation therapy and bone-targeting drugs have made tremendous strides in slowing progression, the prognosis worsens once metastasis begins. That's why unexplained musculoskeletal pain, especially in areas near the prostate, should not be underestimated. The key difference between general wear and tear and cancer-related pain is duration and response to treatment. If rest, stretching, and medications don't provide relief, and the pain worsens over time, your doctor should be alerted immediately. Diagnostic tools like bone scans, MRI, and CT imaging can quickly determine whether there are signs of bone metastases or other abnormalities in the pelvic region. Paired with a PSA blood test and prostate biopsy if needed, these evaluations can catch cancer at a stage where it's still manageable and potentially curable. In cases where the pain is due to another cause, like spinal stenosis or arthritis, you still walk away with a diagnosis and a treatment plan. But in the event that cancer is the cause, catching it early could make a life-saving difference. In a culture where stoicism is sometimes glorified, especially among older men, it's important to stress that pain is not weakness and seeking help is not surrender. In fact, speaking up about this kind of pain may be the strongest move you can make. The body has a remarkable way of signaling distress. Lower back, hip, or pelvic pain that lingers and resists conventional treatment is not just a sign of aging, it's a red flag that should never be ignored. The stakes are simply too high.